That sounds cool. That's cool. So anyway, the society, they embrace cosmetic surgery. We have fellowships. We have continuing education as part of board certification process. It's on our annual site, which is our in-house annual residency examination. And it's becoming more and more popular throughout the years that I've even been in practice. It's just, for me, it was something that when I was training, we were doing these really, really complex, I trained at a level 1 trauma center. So we were doing these really super complex maxillofacial injuries, whether it was a gunshot wound or car accident. So we were, flapping down the foreheads. We're, TMJ approaches, coronal approaches, infraorbital approaches, we were doing everything. And I would see these people who came in basically looking like a bag of bones and swollen as can be. And after, however long of a surgery and then however long of a recovery, I was enamored of and fell in love with the fact that they actually looked pretty good afterwards.
Yeah.
So for me, it was always that, well, if I can do that and I can make those procedures and I can do those procedures, then it won't feel right to me if I just can't do it more on an elective basis too. Yeah. So for me, my trauma training is really the basis of how I know how to do cosmetic surgery. The approaches, the anatomy is all the same. The procedure itself might be a little bit different, but the basics of what we do and how we do it is there. In dental school, the first thing we learn is facial aesthetics. We do that from day one. You have to. The smile, the lips, the proportion of the upper lip to the lower lip, how much tooth show you show in a natural reposed position. These were ingrained in us from day one. When we had to wax up dentures, we had to wax up these little teeth. So the eye to hand coordination, it was instilled in us from day one. So, when people say, how long have you been doing aesthetics? I just go back and say, well, from day one of dental school, because essentially that's when it started. And then needle injections, we've been doing also, there's no one who knows that I know of who can do an anesthetic injection better than an oral max. Again, I'm putting my cheerleading hat on, but we get into situations where it's by anatomical landmark. We don't even see half the things that we do at times. And then the kicker for me was the second I saw orthognathic surgery when I was involved in a corrective jaw surgery. I was in dental school. I wasn't in dental school. I was in undergraduate.
What's your approach to the mid-face from what you used to do, from what you do now? And then my favorite question for you, being a jaw specialist, is what's your favorite approach to this area here? And slight plug, this evening I'm going live with Dr. Greg Miller from My Elevate.
Right.
That's a new adjunct to my face set I've been using.
Yeah, that's awesome. So let's take the first question. Mid-face, I think there's always, from the non-surgical approach, there's just the fillers and the injections, and I think that's always something that first line defense, so to speak. I'm a huge mid-face lifter. I like mid-face lifting. I technically love, from the technical standpoint, I love endotines. I make a small intraoral incision, and then I make a small temporal incision, and then especially if I'm doing an endoscopic brow lift, I'll go ahead and I'll just tunnel right down and connect my intraoral pocket with my temporal pocket, and I'll retrogradely insert the endotine and suture to the temporal fascia and get a nice lift. I know a lot of people get, a lot of surgeons say, well, intraoral, extraoral contamination. From years and years and years of doing facial trauma, intraoral, extraoral, not changing gloves, communicate, the risk of that is very, very little. So from a surgical standpoint, I do like that. The lower eyelid, mid-face junction, I like fat repositioning or fat repositioning, a transconjugal with a fat repositioning. If there's a little skin, I'll laser or do a little skin pinch. And that's probably my go-to technique. I will take a little bit of fat at the same time and just do, very nano fat grafting and just kind of put that in there as a kind of a juicer of it. But I'm not a huge fat grafter. I'll do it, but not a lot. I'll maybe put 7 cc's in a cheek or something like that, just to kind of volumize it. The Accutite now has changed things. So now this, when I discuss surgeries, I'm also discussing Accutite. It's hand in hand. So the discussion is always, we can do this or we can do this. As long as the patients are educated on what Accutite and FaceTite is and what Morpheus is and how long it takes and the reduction of it, it might not be right for everyone, but if they're willing to be patient with it, I think it's a real amazing tool. It's a tool. It's surgery. I don't say it's not surgery.
Yeah.
It is surgical. It's a surgical procedure.
Keep you on just to answer the jawline question.
So the jawline, definitely using a lot of Accutite and FaceTite for jowls and tightening of the lower skin. I'll do traditional face and neck lifting as well. Fillers have been a very popular thing because it's easy, but I also like to do, I'm doing more of these are custom jawline implants. So basically it's an incision on the inside of the mouth from ramus to ramus. We dissect around the mental nerve, and then we put a titanium silicone implant that will give you the angle of the mandible all the way wrapped around onto the other side of the mandible. And it's definitely for someone who maybe needs jaw surgery but not necessarily wanting that, or has done fillers and they don't want the upkeep of the fillers and they're now ready to go ahead. And I use Implant Tech. They're an amazing company. You get a CAT scan of the patient. You send it to them. You work on your model. You work on virtually, so to speak, and you go ahead and you create the implant. It's amazing. It's a great. It's completely aesthetic because you don't see any scars. It's all inside the mouth.
Awesome.
So those are my little tricks that I like to bring to the table. Now I got a few questions for you. I'm not letting you get off free here. Okay.
All right.
Everyone wants to know, how many hours do you sleep?
How many hours do I sleep?
Yes.
I mean, that's a great question. Last night I watched Ozark. I watched the finale of that, which was amazing.
It's amazing, yeah.
I would say I think sleep's important. I think at least for me, 6 hours, 7 hours sleep a night's critical. I do a lot of surgery. We have a practice that's growing and now going through transition. I like to balance. I spend a lot of time with family and, go for walks with my family. I think there's things you have to do,
right.
But I'm very driven. I mean, I just like I like to innovate. I like to change things. I'm doing a meditation, Instagram Live tomorrow night. I think it's good to have mental health. I'm really blessed to have a lot of family support and amazing friends like you who we've connected with. So I think sleep's important. I will sacrifice sleep occasionally if I need to get something done.
Right.
Good question.
All right. I'm going to ask you, are you a coffee, espresso, or a tea guy?
Ooh, if I'm out for dinner, double espresso. If I'm at home, coffee. And if I'm with my parents, chai tea.
Okay, perfect. I love it.
I'm a chameleon.
I love it. You're adaptable. It's great. It's amazing. All right. I got a couple more here. What is your favorite food?
Oh, man. My favorite food is either chicken tikka masala or I think that's it. Chicken tikka masala. Keep it simple.
And then what is the most favorite place you visited in your entire world, in your entire life?
So in medical school, I saved up all my vacation time and took an 8-week backpacking trip through all of Southeast Asia. I kind of got settled there for a day, and then I saw went to Halong Bay, spent some time on South China Sea. I learned to scuba dive in a town called Nha Trang and this place called Hoi An, where I got a custom suit made and shipped it back to the U.S. Then I went down to southern Vietnam, which is Ho Chi Minh City or Saigon, spent a little time there, went to the War Remnants Museum, talked to some non-Americans about the Vietnam War, which is very interesting. Then we got stuck with there was a protest going on in Thailand, so we ended up backpacking through a back road into Cambodia and had to walk across the border and rented some motorcycles and motorcycled through Cambodia into southern Laos. Went to
Did you feel like Rambo?
Yeah, I ate a rattlesnake. That was interesting. And then ended up in northern Laos in a French city called, I'm forgetting the name of it right now. But anyway, it's like the main city there in Laos. Vientiane is the name of the city. And then finally, 6 weeks into that trip, I was like, okay, we got to get back to normalcy. I'd spent about 10 to 25 cents a day at the huts I stayed in on the way, and was literally like on the Mekong River, like with the fishermen's, son, eating fish and hanging out.
Amazing.
And then flew into Kuala Lumpur, flew into Singapore, and then headed back for my medical school graduation.
Wow.
I was president of my medical class, had to give my speech, and had quite a fun speech to give based on that
That's
trip.
yeah, for sure. So,
but I think for me, I think you have to, savor the moment. I mean, I've done other cool trips, but that for me was very nice, and especially it wasn't as touristy back then in Southeast Asia. Yeah. So.
All right, you answered Ozark as your TV show, so that's good. All right, now what kind of music do you play in the operating room?
Oh man, I play. My current favorites are Tame Impala, and I like Sean Paul the rapper, which is hilarious, but I do like it. Right. I just don't like country. I like 90s rap as well. So
I'm a 90s rap guy too. Now, are you Tupac or Biggie or both?
I'm Biggie all the way. I mean, I like Tupac's music, but I'm East Coast, man. I like Juicy, Hypnotize. I like all the good old stuff.
Yeah, man. That's how we roll too. That's how we roll.
Yeah.
All right. That's it, man. I got all my information on you.
I got my questions for you too.
All right. Cool. Let's hit them.
All right. Chinese or Thai food?
Thai food.
Would you prefer to go to Greece or Italy whenever everything's all done?
Whew. I love Greece. I've been there a million times every summer. We go every summer. I love Italy. I've only been once. My wife is Italian, so I bug her to go back, but she prefers, I think, Greece. So we end up going to Greece.
Cool. Next question is, are you a surfer or a skater?
Ooh, I am a very I was a kid, I skated. I'm a very poor surfer. I tried to get on a board. I have a longboard. My friend donated it to me. I'm terrible, but I try to get out there and be one with the water as much as I can.
Awesome. And then what do you like your patients to call you? Last name. Talk to us about what your patients call you versus what your friends call you.
My friends call me Manoli, and my patients call me Dr. M. That's
I like that.
We have to shorten it up. It's too long.
And then the final thing is, what are the trends that you see in aesthetics that are going to be popular over the next 2 years?
Well, I mean, it's been like this forever, but, the more minimally invasive is going to, and devices. I know you bought it and I bought it too. It's Evoke. So I just got it out of the box and it's been sitting there. So I'm really excited about getting that started. And we also got the Tone for Evolve. I'm going to have to hit the Tone because I haven't hit any weights at all lately. So
we're all going to have to do a special on the weight we gain over this break.
For sure. But I do think that, devices, energy, I think lips are kind of waxing and waning. And thank God they're becoming a little bit more natural looking. I think that whole big lip thing it's just an Instagram thing, and it's fine. It works on certain people. But, for the most part, my patients don't necessarily want Instagram lip. They want, fuller but more realistic type of lips. So I think natural is definitely the best way to move forward with the trend. So more natural.
Awesome, man. Well, this has been a blast hanging out. Sorry for the technical difficulties, but I want to do this again and follow up with you once this is all done with.
Man, I had a martini ready for you last night, and I was going to be sipping that. That would have taken a whole different turn of events, but I'm glad.
Awesome, man. Well, good chatting with you. Stay safe. And
you too. Really appreciate it. Stay safe, buddy.
All right, buddy.
Thank you so much. Thanks for everything. Thank you. Be good. Bye-bye. Bye.